Hip bursitis, also called greater trochanteric pain syndrome, is pain or dysfunction on the lateral side of the hip. Now, there can be many causes, and I usually find that weakness of this hip complex is one of the leading causes. I'm going to take you through a program today in sideline without any equipment that is going to consist of 4 exercises. If you can't do one of the exercises, then skip it. If you have any pain or dysfunction, always stop. Now, hip bursitis refers to the inflammation of the bursa, which is a fluid-filled sac that is between tendon and bone throughout our body, and it reduces friction. So as I mentioned, I usually find a weakness of this hip complex can contribute to hip bursitis. So I'm going to take you through a strengthening program. If you have any pain or dysfunction, please stop and make sure you contact your local physical therapist. For my sideline hip strengthening program, we're going to start with the clam. So clam is the first exercise. So you want to make sure you lay on your side nice and comfortable. You can prop up your elbow or bring it down on a pillow. And we're going to start with the clam. So clam is keeping the ankles together, the feet together, and that top leg just lifts up towards the ceiling. You want to make sure you keep that nice and smooth motion and just keep it in a comfortable range. You want to make sure your belly button is pulled in to strengthen your transverse abdominis and keep your core tight. You're going to feel some tension on the side. Now I'm going to go through the program. I'm going to do about 8 to 12 reps. When I feel a good burn, I'm going to move on. The next exercise, exercise number 2, is a reverse clam. So a couple things about this is keep the knees together, and then that foot just elevates up towards the ceiling. Don't worry about how high you lift. Even getting an inch is really good. Okay, so just nice and easy. Make sure you keep that belly pulled in. This is exercise number 2. The third exercise is the fire hydrant. Now that whole complex lifts up. Lead with the knee. All right, don't let the foot tip up. So 8 to 12 reps. This is the third exercise. And then we're going to move to the fourth, which is the hardest, which is your side lying hip abduction. Really get that gluteus medius. You want to make sure you keep your foot forward, nice straight line from your ankle bone to your shoulder. Keep your core tight. All right, and I really feel a good burn in that lateral hip area. And that was set number 1. So I'm going to go through it again, set number 2. So we're going to go to clams, 8 to 12. Now making sure a nice comfortable range. You do not have to go all the way up. You do not have to twist into the back. So nice and controlled. Okay, starting to feel it there, so I'm going to move on. Now reverse clams, exercise number 2. Knees stay together, and that foot elevates up towards the ceiling. Core tight. Don't worry about how high you lift. 8 to 12 reps. All right, that one's tired, so I'm going to move on to the third exercise, which is that fire hydrant. Keeping that core tight. Back is nice and straight. When you feel your low back moving too much, it just means you're going up too high. Okay, fourth exercise, side lying hip abduction, toe pointed forward. Now, common errors with this is if you rotate your foot up and you lean back, then you're working that front muscle, and we don't want to do that. We want to work that side, that gluteus medius. Really feel it in here. Now this is the one that people have most problems with, so make sure you use caution. All right, and that was the second set. And now we're going to go through set number 3. First exercise, a clam, core tight. All right, I feel a good burn in there, so I'm going to move on to the next one. Now knees stay together, lift up. Now you can put a towel in between those knees if it bothers the knees touching together. Let that foot elevate up. Okay, exercise number 3, fire hydrant. Keep constant tension. Try not to let that leg touch. 8 to 12 reps. Leading with that knee up towards the ceiling. Okay, and then exercise number 4, side lying hip abduction. Really get that glute med going, toe pointed forward, Ankle bone lined up with the shoulder. Okay, don't roll back. And don't go up too high, about 8 to 12 inches, whatever feels good for you. Feel that nice good burn. Okay, there you go. That's your side lying series for your hip strengthening program.